Don't forget, as we are talking about the steps of processing the sample, first of all was the direct gram smear. So the second step is inoculation on suitable culture media. How we choose from the different culture media, as we are suspecting typical pneumonia, most common causative organisms. So from all culture media, we choose blood agar appearing red and opaque, heated blood agar, which is called also chocolate agar, and should be incubated at 5 to 10% carbon dioxide incubation for the isolation of strep pneumoniae and Haemophilus influenza organisms. And the last one is the McConkey agar. The McConkey agar is appearing pink and transparent, and this is for isolation and differentiation for gram-negative bacilli, as we are remembering that it's selective and differential for gram-negative bacilli. In the next part of the presentation, we're going to discuss the laboratory diagnosis of common pathogens causing lower respiratory tract infections, as if we are in the lab, it will be the subgroup work. In the first case scenario, we see the symptoms of typical pneumonia, as we discussed before in the first part of the presentation. This case scenario is as follows. A 49-year-old male presented to his physician with fever, chills, cough, and chest pain. As we see, this is the typical symptoms of typical pneumonia. And on examination of this patient, we found that his temperature was 39.5 degree and heart rate was 100 beats per minute, as he is having tachycardia. On chest auscultation, uh, revealed there were crackles and bronchial breath sounds. Crackles meaning there is secretions inside the lung. On chest X-ray, we found that there is left lower lobe opacity with pleural effusion, meaning, as we discussed before, there is opacity, meaning there is pneumonia, but it's taking only the left lower lobe. So it's the symptoms of typical pneumonia, and we will naming it lobar pneumonia, as the symptoms on the chest X-ray taking only the left lower lobe. So, from this case, what is your provisional diagnosis? Of course, it will be lobar pneumonia, as the patient is having symptoms of typical pneumonia, and on chest X-ray, the opacity is concise to the left lower lobe. What are the most likely causative agents? Yes, as we talked before, for the gram-positive organisms, the most common organism is strep pneumoniae, and for the gram-negative bacilli, Haemophilus influenza, Klebsiella pneumoniae, and Pseudomonas aeruginosa. What are the different risk factors you should look for in patient history? As you are taking the history from the patient, you should notice if he is heavy smoker, if he is alcoholic, and if he had splenectomy before. If he had splenectomy, it will be indication for strep pneumoniae infection. And last, history of viral respiratory tract infection, as the bacterial pneumonia is common complication for the viral respiratory tract infection. So, if we are proceeding in the laboratory diagnosis for this patient, the schema for any laboratory diagnosis, the first step is specimen collection. So, the sample we recommend for this patient is sputum, collected in sterile universal container, and its picture is in front of you in the presentation. But remember the precautions. You instruct the patient to give morning sample with deep cough, and the transport of the specimen as soon as possible to preserve the fastidious organisms may be in the sample. In this patient, as we are suspecting the most common causative organisms for the typical pneumonia, which were strep pneumonia, Klebsiella, Pseudomonas aeruginosa, and Haemophilus influenza, the plates we are using is in front of you as follows. The first plate called nutrient agar. Yes, it's yellow and transparent. Its type is basic medium. Okay, the second one is the blood agar, which is red and opaque, and its type is enriched medium, as it contains blood. Okay. The third one is the chocolate agar, which is the heated blood agar, and it's enriched medium also. The last one is the McConkey agar, which is pink and transparent. Don't forget that the McConkey agar was selective and differential for the gram-negative bacilli. Okay, for this case scenario, what are the effects of growing colonies on the different culture media we talked about? Okay, first, if the result on the blood agar at this picture in front of you with greenish color colonies, greenish color around the colonies, it's called alpha hemolysis on blood agar or partial hemolysis, as the incomplete hemolysis of the blood lead to intermediate products for the hemoglobin, causing the greenish discoloration around the colonies. Okay, we should suspect strep pneumonia. Yes, the strep pneumonia is causing partial hemolysis on blood agar. The second most common causative organism for this typical pneumonia in this patient is Pseudomonas aeruginosa. So the cultured plates will be as follows. The first one is the nutrient agar. Remember, the nutrient agar was yellow and transparent, but now it's greenish in color. This is because, yes, the exopigment from the Pseudomonas aeruginosa leading to the greenish discoloration of the whole plate. But remember the difference between it and the TCBS plate. Yes, it is selective and differential for the family Vibrio. Okay, the second plate in the middle is, yes, the blood agar, and the effect of colonies on it is beta hemolysis, complete hemolysis. Don't forget, the blood agar should be lifted in the light to see the transparent zone around the colonies. Okay, the third plate on the right side of the presentation is the McConkey agar, and the effect of colonies on it is non-lactose fermentation. Yes, as it's yellow and brown. If the organism is lactose fermenting, it will be pink in color. So, Pseudomonas aeruginosa is causing exopigment on the nutrient agar plate, beta hemolysis on the blood agar, and non-lactose fermentation on the McConkey agar. In case of Klebsiella pneumoniae, if this patient is having typical pneumonia because of Klebsiella pneumoniae, the effect on the different plates will be as follows. The picture on the left side is picture for blood agar, and the effect of colonies on it is, yes, is no hemolysis or the gamma hemolysis. As we left the blood agar in the light, there will be no transparent zone around the colonies. And the next picture on the right side is the McConkey agar with lactose fermenting mucoid colonies. This mucoid character for Klebsiella is very characteristic for the organism. If we see in our lab this mucoid appearance, we will definitely suspect Klebsiella pneumoniae. If we are suspecting Haemophilus influenza, beside to inoculate the specimen on heated blood agar, the chocolate agar, and incubating it on 5 to 10% carbon dioxide, there is also characteristic pattern for growth of Haemophilus influenza called stellatism, which means that Haemophilus influenza grow better around colonies of Staph aureus. The name comes from satellites. As satellites orbit around Earth planet, Haemophilus influenza grow better around Staphylococcus aureus colonies, because Staph aureus produce products important for the growth of Haemophilus influenza. This is done by inoculation of Staphylococcus aureus on the blood agar in the middle, as we are seeing in the left picture. And then, when you inoculate this specimen on the plate, if it contains Haemophilus influenza, the colonies of Haemophilus influenza will grow around the Staph aureus better, as we see the circles around the middle line. Here's another picture of stellatism. This is a blood agar. The line in the middle is Staphylococcus aureus colonies, and the colonies around it is Haemophilus influenza, which is growing better beside the Staph aureus colonies. This is called stellatism. Don't forget this name. As we proceed in the laboratory diagnosis for this patient, don't forget the schema for any laboratory diagnosis. The first step was specimen collection, the second step is direct gram smear, and then inoculate the specimen on suitable culture media. So when inoculating the specimen on different culture media, the colonies on each culture media will be identified by colonial morphology, then by indirect gram smear, then by biochemical reaction. So, indirect gram smear for the colonies from different organisms. If we having this picture from the colony, we are seeing Diplococci, which is gram positive as it's violet in color. This is strep pneumoniae. Okay. In the other picture, we see pink roads, so it's gram negative bacilli and it's with no special arrangement. Okay, as we proceed in the laboratory diagnosis, after we are doing the indirect film from the colony, if it was gram positive, so the first test to do, yes, the catalase test. To remember about the catalase test, its idea was as follows. We take a drop of hydrogen peroxide on a slide, then put the colony on the hydrogen peroxide drop. If it gives effervescence, so it will be catalase positive. If with no effervescence, meaning bubble, as the hydrogen peroxide is catalyzed into by catalase into water and oxygen bubbles, so it will be with no effervescence, catalase negative. So in the picture on the left side, the test is negative with no effervescence, so the organism is strep pneumoniae. So don't forget the gram-positive cocci was on blood agar giving partial hemolysis. So the organism is gram-positive cocci with catalase negative and partial hemolysis on the blood agar. The next step to do, yes, optokine sensitivity test. The optokine sensitivity test to differentiate between strep pneumoniae and strep viridans. As we know from the catalase test, it is streptococci in general, but it's giving partial hemolysis on the blood agar, so we should perform optokine sensitivity test to differentiate strep pneumoniae from strep viridans. As we see on the right picture, the strep pneumoniae is sensitive to the octokine disc. It's a blood agar plate with inoculated by the specimen and giving the zone of inhibition around the disc of octokine, so it's sensitive, so it is strep pneumoniae. A characteristic test for the strep pneumoniae is Quillang reaction. Quillang reaction comes from the fact that the strep pneumoniae is a capsulated organism. Okay, Quillang reaction is biochemical reaction in which the antibodies bind to the bacterial capsule of strep pneumoniae. Quillang is a German word for swelling, and it describes the microscopic appearance of the pneumococcal capsule after their polysaccharide antigen has combined with the specific antibody. The antibody reaction allows these species to be visualized under microscope, and if the reaction is positive, as we see here on the right side of the picture, we see the capsule becomes opaque and appears to enlarge after we are adding the antibody to the colony. Don't forget the antibody reaction allow these species to be visualized under microscope and identified as the antibody bind to the polysaccharide antigen of the capsule of the pneumococci. In the second scenario of Pseudomonas aeruginosa, it was giving on the plates exopigment on nutrient agar, beta hemolysis on blood agar, and non-lactose fermenting colonies on McConkey agar. And when we performed the indirect gram stain film, it gives, yes, gram-negative bacilli with no special arrangement. So we are identifying the colony. Further identification by biochemical reactions. The first next step with non-lactose fermenting colony bearing gram-negative bacilli is doing oxidase test. Yes, don't forget the oxidase test is the left picture, and the concept of the oxidase test, we are using paper strip and we are putting a colony from the plate on it. If it's turning into purple, so the test is positive, and the characteristic test for the Pseudomonas aeruginosa is that it is oxidase positive. Okay, then we perform the most famous four biochemical reactions. We are having these four pictures of the four biochemical reactions. The first one is the triple sugar iron. Can you remember the triple sugar iron? It was containing three sugars, yes, and iron, sulfur containing amino acid. This result for the triple sugar iron is, yes, no fermentation and no H2S production, as this is the original color of the triple sugar iron. There is no change in color into yellow, or there is no blackening in the triple sugar iron. So the result of Pseudomonas aeruginosa on the triple sugar iron is no sugar fermentation, no H2S production. The second tube was flowed, you remember it? Yes, it's called indole test. Indole test was performed by adding the organism on the peptone water to detect, yes, its ability to produce the indole from tryptophan amino acid. This is negative test for indole, as there is no red ring on the top of the tube. Okay, the last two slopes, yes, is the urease and citrate. The result for urease and citrate, the urease is positive, as the negative one is yellow. Don't forget, the positive is pink in color, so urease is positive, and citrate is also positive as the positive is blue. The concept for urease test, that is testing the organism ability to produce urease enzyme, and we are putting it in a urea containing media so the organism, if it was producing urease, it consumes the urea and produce ammonia. And the concept for the citrate, to use the citrate as sole carbon source. So Pseudomonas aeruginosa, to summarize, is oxidase positive triple sugar ion with no fermentation of sugars, so it remains reddish brown. On indole, it's indole negative with no red ring on the top of the tube. And for the citrate and urease, it's negative, so the urease pink is positive, citrate blue is positive. As for the scenario of Klebsiella pneumoniae, if the organism gives the no hemolysis effect on the blood agar or the gamma hemolysis, and the mucoid, don't forget my mucoid, lactose fermenting pink colonies on the McConkey with gram-negative bacilli in direct film. So the first step is oxidase test to differentiate the Klebsiella pneumoniae. The oxidase test is negative. As we see on the left picture, the paper strip has no purple color on it, so the Klebsiella pneumoniae is oxidase negative. As for the result for the other four biochemical reactions, the first one is the triple sugar ion. To interpret it, yes, it's having fermentation for the three sugars with acid and gas. As we see, there is a gas bubble in the bottom of the tube. The second test is indole, yes, and it's also negative. There is no red ring on the top of the tube. For the citrate and urease, excellent. It's positive as the urease pink is positive, the citrate blue is positive. So don't forget Klebsiella pneumoniae is oxidase negative. On triple sugar ion, it ferments the three sugars with acid and gas. H2S negative, there is no blackening. On the indole, it's negative. On citrate and urease, it's positive. Okay, now take a deep breath. We are almost done about this presentation. We are having this last case scenario. This patient is 70-year-old man, has a 2-month history of progressive weakness, weight loss, intermittent fever, chills, and productive cough of yellow sputum, occasionally streaked with blood. His chest X-ray revealed cavitary infiltrate of the left upper lobe. In this case scenario, what is your provisional diagnosis? What do you think about this case? This man is old age, first of all, in this case. In any case you are given in the written exam or in the practical exam, there are different keys in the case. The first key is that this patient is old age, have a progressive illness, meaning that he is having a chronic illness, not acute as the typical pneumonia, but it's chronic for 2 months, with other symptoms other than the typical pneumonia, which are the weight loss, the weakness, the intermittent fever and chills. These symptoms are called toxic symptoms. And also his sputum is yellowish, occasionally streaked with blood. Okay? The last one, the last key is the chest X-ray. Chest X-ray is revealing cavitary infiltrate on the left upper lobe. This is going with, yes, pulmonary tuberculosis, of course. This In case of pulmonary tuberculosis, it's very clear that this patient is having pulmonary tuberculosis, as of all of his symptoms is going with pulmonary tuberculosis, and the Mycobacterium tuberculosis is loving the oxygen. It's obligatory aerobes. So the lesion in the Mycobacterium tuberculosis most probably will be in the upper lobe of the lung, which is having the highest concentration of oxygen. Okay, the causative organism for pulmonary tuberculosis is Mycobacterium tuberculosis. Okay, what are the clinical samples can be used for microbiological diagnosis? Remember, it's the first step for the laboratory diagnosis. Don't forget, as we discussed in the first presentation for the diagnosis of the pulmonary tuberculosis was sputum. But don't forget, sputum must be uh, given in the early morning and given 3 samples for 3 successive days to be reported negative or positive for pulmonary tuberculosis. If we are having troubles in having sputum, we can have bronchial washings or pleural fluid or gastric aspirate. Don't forget in the case of children. As we discussed in the previous presentation, sputum sample from pulmonary tuberculosis patient should be processed in certain way. First, it should be decontaminated to prevent bacterial overgrowth. This is done by adding sodium citrate with N-acetyl L-cysteine to digest in mucus and with 4% sodium hydroxide solution to decontaminate the sample. Decontamination to prevent the bacterial overgrowth, and the sodium citrate with N-acetyl L-cysteine to liquefy the sample to facilitate the concentration by centrifugation. The centrifugation is done for the sample for 15 minutes at room temperature to concentrate the sample. As we discussed before, the sputum sample for pulmonary tuberculosis suspected patient can't be stained by gram stain, as Mycobacterium tuberculosis bacilli can't be stained by gram stain for its special cell wall content of lipid. It has thick cell wall. So it was stained by, yes, the acid-fast staining by Zell-Nelson method. This picture of Zell-Nelson film, the black arrow is marking the pink bacilli of the Mycobacterium tuberculosis stained with concentrated carbofucsin by pink color, and the background of bus cells and squamous cells stained by the blue color of methylene blue. To remember the types of staining for the acid-fast bacilli, there was 2 methods for staining: the acid-fast staining and the fluorescein or amine rhodamine dye. For the fluorescein or amine rhodamine dye, we are using the fluorescent microscope, not the ordinary light microscope, because the fluorescent microscope is using the UV light for demonstration the bacilli by fluorescence against dark background, while the acid-fast staining was performed by 3 steps of primary stain with concentrated carbofucsin, then by heating in the Zell-Nelson stain method, and different from the Kenyan method, that the Kenyan method has higher concentration for carbofucsin, so it doesn't need heat for uh, inserting the stain into the bacilli. Then the next steps were the uh, decolorization by sulfuric acid. Then the last step was the counterstain of the methylene blue. To isolate the Mycobacterium tuberculosis, okay, we are using either traditional methods or commercial methods. You remember that? Of course. The traditional methods, they were liquid, agar-based, which we are calling Middelbock, and the egg-based. Yes, this picture is the Loewenstein-Jensen medium. The green slope, there are no other green slope in our curriculum for practical sessions. The only green slope is this slope of Loewenstein-Jensen medium. It is enriched because it containing egg and selective for the Mycobacterium tuberculosis as it's containing the malachite green, leaving it selective only for the Mycobacterium tuberculosis. The growth of Mycobacterium on these traditional Loewenstein-Jensen medium is taking from 4 to 8 weeks, which is relatively long period of time. So the other available, more rapid isolation for the pulmonary tuberculosis is, yes, the commercial method, which is the Mycobacterial growth indicator tube, abbreviated MAGIT. Okay, the MAGIT principle, as we discussed before, that was it's containing liquid media in a tube, and this tube was containing oxygen sensitive fluorescent sensor in the base of the tube. If the specimen has Mycobacterium tuberculosis in it, it will multiply and consume the oxygen in the tube, so the oxygen sensor will fluoresce and the fluorescence is observed under ultraviolet lamp. Okay, this is the principle of the Mycobacterial growth indicator tube. To remember, it is commercial media, the Mycobacterium tuberculosis to grow on the maggot, taking 2 to 4 weeks, so it's more rapid than the traditional methods. The traditional methods is taking from 4 to 8 weeks. Half this time is 2 to 4 weeks. The maggot is taking 2 to 4 weeks. Okay. This is a picture of maggot. As you see in this picture, the bag containing tubes. In the bottom of the tube, there is a oxygen sensor, fluorescent sensor. If the specimen is positive for Mycobacterium tuberculosis, the growth of Mycobacterium tuberculosis will appear by fluorescence of the sensor and is observed under the ultraviolet lamp to be seen the sensor glowing as we are seeing in the right tube in the rack. What is the value of culturing the causative agent? We should ask ourselves this question. If the staining methods are sensitive to detect if the sputum is positive or negative for the pulmonary tuberculosis, why we should do the culturing methods? Of course, because it have many benefits. The first benefit is the culture is more sensitive than the microscopy only. Okay, if the microscopy result is negative, the culture result may be positive. Okay, the growth of organism is necessary also for the precise species identification. If we need to identify the species of the Mycobacterium tuberculosis, if it's Mycobacterium bovis, if it's Mycobacterium tuberculosis, we should perform culturing. Okay, if we in need for doing drug susceptibility testing. Drug susceptibility testing to be done, it needs colonies growing on the culture media. The last benefit from the culturing system is to perform genotyping for cultured organisms. If we have colony on the culture media, we can do the DNA sequencing for these organisms, and this will be beneficial for epidemiological purposes to know if these strains is similar in its DNA sequences in different patients and in different sites. Okay. Is there a faster specific laboratory technique for diagnosing or confirming the infection for pulmonary tuberculosis? As we learned that traditional methods is taking from 4 to 8 weeks, and the commercial methods, the magic system, is taking 2 to 4 weeks. So it's relatively a long time to diagnose a patient with pulmonary tuberculosis in 2 weeks. So, of course, there is faster testing for pulmonary tuberculosis. It's called pulmonary polymerase chain reaction, the PCR. The PCR is detecting the nucleic acid for the TB, so it is the most rapid, most sensitive, most specific method to detect also the resistant strains. We detect the genes for the antibiotic resistance. But of course, the disadvantage for it is it's slightly expensive, as you are hearing for the testing for the coronavirus, which is epidemic nowadays. The PCR first obstacle is it's expensive and taking a lot of resources to be done in every facility. Okay, finally, to summarize our spots. If you are in the lab for the subgroup, you have spots to be revised after we finish the subgroup. So you should remember our spots. For case scenario 1, we're having the universal container for collection of sputum. Don't forget, it's a sterile universal container. Okay. You can, of course, go back to the rest of the presentation to revise the pictures of each of these spots. Okay. Then, for the strep pneumoniae scenario for the case 1, we're having gram-stained film, diplococci in between the pink segmented cells, the picture for alpha hemolysis on blood agar, the picture for catalase negative test, okay, and the picture for the optokine sensitivity, which is sensitive in the case of strep pneumoniae, and the last, the Quilang reaction, okay. And for the scenario for the gram-negative bacilli, there is a slide of the gram-negative bacilli with no special arrangement. In case of Klebsiella pneumoniae, we were having lactose fermenting colonies on the McConkey agar, no hemolysis on the blood agar plate, the RAG for biochemical reaction of the Klebsiella pneumoniae, including the TSI with fermentation of the 3 sugars with no H2S production, with acid and gas production with gas bubble in the bottom of the tube, indole negative, citrate urease positive. In case of oxidase test, Klebsiella pneumoniae is negative for oxidase, and for Pseudomonas aeruginosa, the plates we are seeing were exopigment for Pseudomonas, hemolytic colonies, beta hemolytic colonies on the blood agar, and non-lactose fermenting colonies on McConkey agar. Okay, the biochemical reaction for Pseudomonas, don't forget, Pseudomonas were oxidase positive, and the 4 biochemical reactions in the back were TSI, were no fermentation for sugars, Indole is negative, citrate we release are positive. Okay. The last organism is Haemophilus influenza. Don't forget Haemophilus influenza should be inoculated in chocolate agar, incubated in 5 to 10% carbon dioxide in the incubator. Don't forget the picture of the characteristic cytolytism of the Haemophilus influenza around the Staphylococcus organism colonies in the middle. Okay, this is for the case scenario 1. For the case scenario 2, we were having patients for uh, with pulmonary tuberculosis. Uh, we saw in this scenario the slide for acid fast staining, the Zell-Nelson method, with pink bacilli over blue background, and traditional methods for isolation, which was the green slope, the only green slope in the practical sessions, the Levenshtein-Jensen medium, and last the Maget system picture with glowing sensor in the bottom of the tube. Okay? Thank you so much for listening to this presentation. I hope it will be beneficial for you and you gaining a lot of information from it. Thank you very much.